A stroke does not always begin with a collapse. Sometimes the only warning is a 5-minute problem with speech, vision, balance, or one side of the body. But many strokes give no warning at all, so any sudden sign may mean the emergency has already started. I'm Catherine Blake, and I want to explain this calmly and clearly. The phrase, "the day before a stroke," can be misleading. There is no dependable 24-hour countdown. What some people experience is a transient ischemic attack, or TIA, before a larger stroke. A TIA produces stroke-like symptoms that may fade within minutes, but it is still a medical emergency. Think of a TIA as a warning light caused by a temporary interruption in the brain's blood supply. The light may switch off, but the problem behind it may still be there. The American Heart Association reports that nearly 1 in 5 people with a suspected TIA will have a stroke within 3 months, and almost half of those strokes happen within 2 days. Consider a common situation. A man in his late 60s is drinking coffee when the cup suddenly feels weak in his right hand. His words sound thick for about 10 minutes. Then his hand feels normal and his speech clears. He decides he must have slept badly and continues his day. That evening, the weakness returns and does not go away. The mistake was not failing to predict the future. The mistake was treating the first sudden episode as harmless because it ended. Today, I'll show you 7 patterns that can appear before or during a stroke, followed by the exact steps to take. The most important word is sudden. A symptom that begins abruptly, like a switch being flipped, deserves special attention. The first pattern is brief weakness or numbness on one side. People often blame a numb hand on sleeping awkwardly or holding a phone too long. That can happen, but pressure on a nerve usually follows a clear position and improves as the pins and needles settle. Stroke-related weakness often arrives without that explanation and may affect the face, arm, or leg on the same side. The brain sends movement signals like a control room sending instructions through electrical wires. When blood flow is blocked, one part of that control room loses power. A smile may become uneven. One arm may drift downward. A leg may suddenly feel heavy. The CDC lists sudden one-sided numbness or weakness as a major stroke sign. If this appears even for 1 minute, call your local emergency number. Do not wait for a second episode. The second pattern is a sudden change in speech or understanding. People may assume they are tired, distracted, or simply searching for a word. Ordinary word-finding pauses happen gradually and occasionally. A TIA or stroke can make clear speech suddenly slurred, turn familiar words into the wrong words, or make a simple sentence hard to understand. Language areas in the brain work like a translator and a message center. The thought may be present, but the message cannot be formed or delivered correctly. Ask the person to repeat a simple sentence such as, "The sky is blue today." If the words are slurred, confused, or missing, treat it as an emergency. Do not argue with the person or ask them to rest first. Note the time the change began. The next sign is where many people get caught off guard. Sudden vision trouble. It may be blurred vision, double vision, or a dark curtain over part of one eye. People often blame glasses, dry eyes, or a bright screen. Those problems are usually less abrupt. A sudden loss or change of sight can mean that blood flow to the eye, or the visual part of the brain has been interrupted. Imagine a camera working normally while the cable carrying the picture is briefly pinched. The scene is still there, but the signal cannot reach the screen. A retinal TIA can behave in a similar way. Sudden trouble seeing in one or both eyes is on the CDC's stroke warning list. Covering one eye, rubbing the eyes, or waiting for sleep does not test the cause. Emergency assessment and brain or blood vessel imaging may be needed. The fourth pattern is sudden trouble with balance or coordination. Dizziness is common and is often caused by dehydration, medication, or an inner ear problem. Dizziness alone does not always mean stroke. The concern rises when it starts suddenly and comes with double vision, slurred speech, weakness, numbness, a severe headache, or an inability to walk normally. The back part of the brain is like a navigation system. It helps coordinate the eyes, limbs, and balance. If its blood supply is interrupted, the body may pull to one side, the feet may not follow instructions, or the room may seem to spin. The CDC includes sudden dizziness, loss of balance, and lack of coordination among stroke signs. Sit or lie down safely, avoid walking, and call emergency services. Do not drive yourself. If this explanation is helping you recognize the difference between a gradual problem and a sudden neurological change, comment yes. That simple response also helps more people see this information. But this is where it gets more serious. The fifth pattern is a sudden, severe headache with no known cause, especially when it is unlike the person's usual headaches. People may assume it is stress or a migraine. Many headaches are not strokes, and a familiar migraine can include visual or sensory symptoms. The dangerous pattern is an explosive or unfamiliar headache, especially with vomiting, confusion, weakness, fainting, a stiff neck, or a change in vision. Some strokes happen when a blood vessel ruptures and bleeding presses on brain tissue. Picture a pipe bursting inside a closed control box. Pressure rises, and nearby circuits can stop working. This is one reason not to take aspirin on your own for possible stroke symptoms. Aspirin can worsen a bleeding stroke. Call emergency services and let clinicians use brain imaging to determine whether the cause is a blockage or bleeding. The sixth pattern is sudden confusion or loss of a familiar ability. A person may not recognize where they are, may struggle to read a short message, or may suddenly use a fork, phone, or key incorrectly. Families sometimes call this aging, low blood sugar, or fatigue. Those conditions can mimic stroke, but a sudden new change still needs urgent medical evaluation. The brain works like a team of specialized departments. One handles movement, another language, another vision, and another planning. A small interruption may affect only one department, so the person may remain awake and look mostly normal. That is why a single odd symptom should not be dismissed. If possible, note exactly what changed, and when the person was last known to be normal, then call for an ambulance. The seventh pattern is repetition. A brief episode may occur once, disappear, and return later. People often feel reassured between episodes. In reality, repeated spells can mean that blood flow is unstable, like a loose flap in a pipe that keeps blocking and releasing the stream. The symptoms may last seconds or minutes, but repetition does not make them less important. It raises concern. ATIA cannot be safely diagnosed at home. The American Heart Association advises emergency assessment even when symptoms disappear within an hour. Scans, heart rhythm testing, blood tests, and examination of the blood vessels may help find a narrowed artery, a clot, or an irregular heartbeat. Early treatment may reduce the chance of a larger stroke. Do not schedule a routine appointment for next week. Seek emergency help now. Remember the FAST check. F is for face. Ask for a smile and look for drooping. A is for arms. Ask for both arms to be raised and watch for one drifting down. S is for speech. Listen for slurring, missing words, or confusion. T is for time. Call the local emergency number immediately. Also remember sudden balance and eye problems, because not every stroke fits the basic FAST pattern. While help is coming, keep the person safe and comfortable. Note the exact time symptoms began, or the last time they were known to be normal. Do not let them drive, and do not drive them yourself when an ambulance is available. Do not give aspirin, food, drink, or supplements unless emergency professionals tell you to. Symptoms can affect swallowing, and the type of stroke is not yet known. Prevention matters, but it belongs before an emergency, not during one. Work with a clinician to control blood pressure, diabetes, cholesterol, smoking, and irregular heart rhythms, such as atrial fibrillation. Take prescribed medicines exactly as directed. Some people ask about omega-3 supplements. They may support triglyceride control in certain people, but they cannot stop an incoming stroke, and may interact with blood-thinning medicines. Consult a doctor before using them. Now you know the central truth. A stroke may not provide a warning the day before. When it does, the warning may look like a short burst of one-sided weakness, speech trouble, vision loss, imbalance, severe headache, confusion, or repeated episodes. The fact that a symptom disappears does not make it safe. It may be the brief opening in which fast medical care can prevent greater harm. Your immediate action is simple. Learn fast, add sudden balance and vision changes to that memory, and make sure the people in your home know the local emergency number. If a sudden sign is happening now, stop watching and call emergency services. Subscribe for more calm, practical health guidance. Share this with someone who may dismiss a brief symptom because it went away, and leave a comment about the sign you will remember.